हेलो गाइज, वेलकम बैक टू माय चैनल। इस चैनल पे हमने व्लॉग्स किए हैं, एंटरटेनिंग वीडियोस किए हैं और सिंगिंग भी किया है। सो इस चैनल पे हम लोग आज कुछ नया करेंगे, पॉडकास्ट करेंगे विद डॉक्टर सुभाष खत्री सर। डॉक्टर सुभाष खत्री सर, द ग्रेट पर्सनैलिटी। सो डॉक्टर सुभाष खत्री सर, he has done his PhD in sports medicine and physiotherapy. सो बेसिकली वो उनको 23 years का टीचिंग एक्सपीरियंस है एंड today we are going to do the podcast with Dr. Subhash Khatri sir and he is there. Welcome sir, welcome to the podcast.
Thank you so much.
Thank you sir for your valuable time. You have अपने टाइम निकाल के हमारे लिए हमारी मदद करने के लिए आपने पॉडकास्ट के लिए यहाँ बोला, इसलिए थैंक यू सो मच सर.
My pleasure. My pleasure. Can I sit?
Yes sir. So sir, we'll start with the podcast directly to the point, coming straight in your expertise in your profession. So sir, basically what is physiotherapy? So how can we explain to the people what is physiotherapy exactly?
Well, that's a very good question. It's been a long time. People were always thinking about what is physiotherapy profession. But today, I have a different opinion. Today, almost everyone knows what is physiotherapy.
Yeah.
The reason is very simple, because each one of us has got one or the other patient who was referred for physiotherapy, and that's how everyone's perception is now that okay, we know about this profession. But it just reminds me, when I was a student, we had to tell the people what physiotherapy is. So in a simple words, you can say that treatment of various diseases and disorders without any drugs, without any surgery. So you can say that the treatment which is done with the physical medicine, that means which doesn't require any chemicals or which doesn't require any medicine or surgery. So when we say non-surgical treatment approach, we use physical medicine modalities, such as we use electricity in form of electrotherapy, we use therapeutic exercises also, we perform manipulation, mobilization of the joints. And today it has just happened that right from the birth, physiotherapy is required till the death. We call neonatal physiotherapy, or otherwise you can say pediatric physiotherapy, and even at old age we call it as geriatric physiotherapy. So right from the birth, everyone requires treatment. One of the good advantage of physiotherapy is whether you take medicine like allopathy, whether you take Ayurvedic or homeopathic, we don't say you stop that treatment and start our treatment. Physiotherapy can be taken with all this kind of the so-called medicines. In my opinion, till you don't find any medicine that can recover your muscle power, or the strength, or the coordination, or the joint mobility, physiotherapy is going to survive. And today you must have heard that most of the conditions, including say some of neurological conditions, including brain tumors, or there is paralysis, ultimate end of treatment is with the physiotherapy. So even if patient goes to say medical doctor or otherwise for consultation to super specialist, ultimately each one of them they refer the patient for physiotherapy. The advantage of physiotherapy is it can be like more of preventive also, supportive also, curative also. And the best part of physiotherapy is like when patient comes for physiotherapy, slowly patient realize that I'm getting some independence in my day-to-day activities. Like I'm finding pain-free movements, I can perform my own self-care, and I can go back to my professional or otherwise job-related activities. So in short, to answer your question, physiotherapy is treatment with physical medicine modalities. Otherwise, you can say drugless treatment approach. I'm sure you must have seen a movie called Khoobsurat.
Yes.
So in that movie, the role of physiotherapist is clearly depicted.
Yes.
Thank you.
Yes, sir, but majority of the people have their own conceptions. Like physiotherapy, it is a massage. So how is the massage and physiotherapy, or what is the role of massage and physiotherapy, or physiotherapy is a massage? What exactly it is?
Well, I believe that that's a wrong concept, but then we got to be prepared with lot of quack in almost every profession. Even medical profession has quack, dental profession has quack. So likewise, there are some people like who calls themselves like a bone setter, otherwise massager, and so on so forth. Remember that physiotherapy has got nothing to do with all these kind of things. Like in physiotherapy, we are bothered about whether patient has got problem in the joint, bone, or there is other soft tissues, and we want to correct it. So we have varieties of the things. We call it as a soft tissue manipulation, which traditionally was called as a massage. But let's understand that our soft tissue manipulation involves most of the skilled activities, like we call it as a passive movement, relaxed passive movement, stretching. Some of you must not have even heard about it. And when we go for mobilization, we call it as a mobilization with thrust, mobilization without thrust. And when we do that, it is more in scientific way, so that our patient is not harmed, but our patient is benefited with this kind of the treatment approach. Now, when you go to the person who doesn't have a medical professional knowledge and start working like a bone setter or otherwise massager, he starts thinking that everything is out of place and try to place it back and so on and so forth. In that bargain, what happens? Sometimes what you call patient gets a lot of problems or complications. These complications can be even, injury to the joint, we call it subluxation, dislocation. And when sometimes people goes for, say, neck or the cervical spine, this kind of activities, it can cause even death also, or there is paralysis of all four extremities. So I would suggest that if you are an educated person, please avoid going to any quack from any profession, including physiotherapy. Try to go to the physiotherapist. When you go to physiotherapist, also go with your medical record, investigations, so that your physiotherapy doctor understands and treat you very well. Remember that misnomer or otherwise labeling is one of the bad tricks that can be used. And remember that physiotherapy is like more of professional course which has got integration of most of the medical subjects, including the clinical subjects. And shortly, let me conclude. We want to treat the patient with varieties of the things, including the movements also, including the manipulations also, including the electrotherapy modalities and machines also. So that's a wrong concept when you think that, okay, massage is physiotherapy and physiotherapy is a massage. Remember that physiotherapist opens the clinic. Physiotherapy doesn't open the massage. Thank you.
Sir, by your explanation, I think everybody has got the clear answer that physiotherapy isn't the massage only. So now next question is, what are the different branches of physiotherapy, and which branch we can do the physiotherapy? We have physiotherapy.
I think now we are getting more involved into physiotherapy profession. When I started my career, as I told you, people were not aware about physiotherapy. But today we have neonatal physiotherapy as one of the specialty. Then we have pediatric physiotherapy. Then we got orthopedic physiotherapy. We have neurophysiotherapy. Then we got community physiotherapy. We got geriatric physiotherapy. We got industrial physiotherapy. We got sports physiotherapy. We got oncological physiotherapy. We got physiotherapy OBG, otherwise we call women's health physiotherapy. Likewise, a lot of branches are evolving, like including clinical biomechanics also. So there are many more branches in physiotherapy where the physiotherapists are getting trained themselves and becoming not now just a specialist but super specialist. Like if I interact with some of the physiotherapists from other countries, they say I'm a hand therapist, I'm a shoulder therapist, I'm a therapist for foot, we call podiatric physiotherapy. Likewise, people are specializing in different regions. Forget about just one specialty. So today we can see that people say I'm a stroke physiotherapist. Say I'm a physiotherapist working with just autism or there is autistic things. Likewise, you can say that some people specialize in play therapy also. Likewise, today is an era where you can find that the people are going into ultra specialization. One of the right now ultra specialty which has got highest demand is ergonomic and physiotherapy. We call ergonomist. So likewise, slowly as the time goes on, we are getting more and more involvement of technology, and as a result today we have something called robotic physiotherapy also, even physiotherapy with AI. So likewise there are upcoming branches and subspecialties or super specializations in physiotherapy also. Unlike our country, in Western countries we have integrated course, we call it as a DPT, that is Doctor of Physical Therapy. So that is like instead of you doing bachelor's, then master, then PhD, it is like integrated program and you've got multiple kind of entries and exit. So all over the world, slowly the program we call it as a DPT, that is Doctor of Physical Therapy, is getting popular and people are opting for varieties of the subspecialization. I forgot to mention one of my students has specialization AIDS only. So you got physiotherapists in AIDS. So likewise, there are a lot of avenues where you can become specialist.
Sir, what exactly is the role of these all branches in healthcare management?
Okay, let us put it in a very simple way. Like when we talk about the role, a role is like different. Like you can say sometimes it is like a curative, sometimes it is like a supportive, sometimes it's like a restorative, or sometimes it is like a palliative or a preventive. Depending on what specialty and where you are working, like whether you are working with non-communicable diseases, or whether you are working in intensive care unit, otherwise you are working in a surgical unit. Depending on what kind of patient, what kind of specialty you are working, we have different roles. Like for instance, the patient has got amputation and the patient is fitted with the prosthesis. So your more of role is rehabilitative, or is restorative. And when you are working in intensive thoracic unit, otherwise the patient who are undergoing bypass surgeries, and then you are working as a physiotherapist. So there your role is more supportive because that entire surgery is done by cardiothoracic surgeon. So likewise, let me recall and just put it in simple words that your role could be preventive also, curative also, supportive also, restorative also, and palliative. When I say palliative, when you are working into oncology or otherwise say patients with the cancer, sometimes your role is even palliative because you know about the fate of the patient, but still you are treating the patient so that patient has well-being, patient has good quality of life, and patient doesn't feel that I am left alone. So understand very well that every time it is not curative, every time it is not palliative, it depends on what kind of patient or what kind of specialty or setup you are working, your role varies.
Okay, sir. Sir, many of the people think that there are no benefits of physiotherapy. So can you tell us the benefits which are,
Okay, that's a good question. Remember that very simple thing is like that's a blanket statement when someone says that I have a benefit or I don't have benefit. I would just request those who have some kind of doubt to come to our clinical setup and just look at the patients. Now what happens, just imagine that patient who was on some medicine, patient who was even referred for surgery, who comes for physiotherapy and gets cured, and when patient is happy, those are the patient themselves speaks. So let's understand that benefit of physiotherapy, of course direct benefit is like, as I already said, that there is not a single medicine or there is pill or there is surgery that can restore your say activities of daily living, your joint mobility, or there is your strength, or there is your endurance, or there is your coordination. And definitely when patient comes to physiotherapy, you can see the changes in terms of what you call pain-free movements, in terms of strength also, endurance also, coordination also, ability to perform different functions such as walking. And I can show you a lot of patients comes in wheelchair, but then over the period of time when we treat them, when we perform something called gait training and other things, they become independent. So try to understand that physiotherapy itself is beneficial. And if it was not beneficial, then my patients would have come to physiotherapy.
Yes. Okay. Sir, many of the people say like physiotherapy, it's only a gym, secondary gym, or we can say like that. So what are the differentiating factors regarding physical fitness of physiotherapy and a gym?
Okay, very good question. Understand the two different things. When you are a physiotherapist, you are dealing with the people who are not normal. We call it as a patient. So that means who doesn't have normal muscle power, who has got weakness, paralysis, and so on. Remember that those patients who have pain, who has got issues like this, they come to us. And when you talk about the gym, the normal people who want to maintain their muscle strength, power, or others develop the body, they go there. Now, when you go to gym, you have an instructor or there is physical fitness trainer who is just having some knowledge about dealing with the normal body and how to, what you call it as improve your body power or the strength and so on. Understand that we are a physiotherapist, we are working with the patients who has got disease, disorders, and so on. And then when we are trying to treat these people, we are trying to strengthen their muscles, or improve their balance, coordination, and so on. Understand that we are treating patients. We are not dealing with the normals and doing bodybuilding. So that's the biggest difference. And understand that physiotherapy doesn't mean that we are opening a gym for normal people. Whatever we have instruments that are used for exercises or strengthening the muscles, they are used by these patients who himself doesn't have the normal power. So let's come out of this concept of this, and we call it as a therapeutic gymnasium. That means whenever we have some equipment otherwise set up like gym, we are using it for treatment purpose and we are not using it for bodybuilding. And I think in my opinion that's one of the biggest difference there.
Okay, sir. Sir, can a physiotherapist prescribe medicines? And if yes, can medicines go supplementary with physiotherapy?
Okay, the first question is, can a physiotherapist prescribe the medicine? As of today, as per our country's laws, we cannot prescribe the medicines. Of course, in some of the countries like UK, there are limited permissions for physiotherapists to prescribe the medicine. But when as a physiotherapist you study the entire curriculum, you have a knowledge of pharmacology and medicine, so that you can use some of the medicines along with the physiotherapy treatments, such as we call it as a 404 assist, that is applying the ultrasound with medication such as analgesic ointment. Others use iontophoresis. You are once again using medication. So say you are applying nebulization, you are using medication such as bronchodilators. So physiotherapists do have some role to use medicines along with their treatment. But officially, as on today, in our country, a physiotherapist doesn't have permission to prescribe the medicines. And that's how we say, more or less, this is a drugless treatment approach. I forgot, what was your second question?
Sir, can medicines go supplementary with physiotherapy?
Obviously. See, imagine the patient who has got a joint pain, and if the patient is taking medicine to reduce the joint pain, then it becomes easy for physiotherapists to treat the joint, perform varieties of the therapeutic exercises such as strengthening also, stretching also, mobilization also, because now the patient doesn't have much more pain, and that becomes easy for us to treat the patient. So once again, let me recall, whether the patient takes allopathic medicine, or the patient takes Ayurvedic, or the homeopathic, that doesn't come in the way of physiotherapy. But of course, we have our own tricks to tell the patient when to take the medicine, so that should not interfere into our treatment. Sometimes the medicine itself has side effects, such as say you are taking medicine for cholesterol, that can cause muscle weakness around quadriceps and so on and so forth, and then that comes in the way. So in such kind of cases, we talk to the clinician who has prescribed the medicine and try to help the patient in a better way. So to answer your question, along with the medicine, physiotherapy can be taken, and let's look at the combined approach. I always say that patient has to also get involved in his own treatment, patient's family also, a doctor also, physiotherapist also, and the surrounding also. So what happens? Together these efforts from patient, the physician, physiotherapist becomes a holistic approach to minimize the patient's problems. So I think that's well and good that the patient continues with the medicine. Sometimes what happens, patient thinks that, okay, I'm taking physiotherapy, so I should stop medicine. No, your doctor has prescribed the medicine with a dose, your doctor must have said how many days to take it and so on and so forth. So I would advise the patient not to stop, otherwise change the drug, otherwise medicine when you are taking physiotherapy.
Okay, sir. So many of the students have this question, especially the NEET aspirants, like how is physiotherapy as a career opportunity, and is it a lucrative job?
Every profession has its own ways to work on. As on today, if you just simply look at the calculation, that is number of say people or population of our state, country, and number of physiotherapists, there's a vast difference. So in short, if you go into the management terms such as need and supply, there's a lot of gap. So I'm sure you know that there's a lot of requirement for physiotherapists than what we have, the qualified physiotherapists. But let's answer to your question. When it comes to the careers, this is like a professional career. This is like a service sector. So it all depends on your skill. Now, for instance, you got very good skill. You could be earning much better than the other person who doesn't have skill. Others, just imagine that you are into the clinical practice instead of a job. So you could have different ways of looking at it. But let me just tell what is routinely the things are going on. After graduation, nowadays most of the people goes for post-graduation. Unlike during our days when the people used to immediately open up the clinic and start practicing or was doing the job. So let's look at varieties of the career options there are. Like you can open up your clinic, you can work in hospital, you can work in hospices, otherwise you can go for post-graduation, you can go abroad for higher education, otherwise post-graduation, you can go for specialization. All over the world, there is the highest demand for physiotherapy profession. If you look at that, the classification of different jobs, this is one of the highest paying job in most of the developing countries. So right now what is happening, most of our students jump into physiotherapy so that they will get an opportunity to go abroad, they can do post-graduation or the higher studies and then they can hang on. The reason for that is, it is the currency difference, and that's how, in my opinion, those students who wants health sciences career and who wants to go abroad, they have understood one fact very well, that even if you do say medicine like MBBS, you need to pass your USMLE and so on and so forth. Or if you do BDS also, then also it is difficult to go abroad. But if you do physiotherapy, it becomes that way quite easy. And most of our students get immediately the student visa in say US, Canada, Australia and things like that. That's why I had found one trend, that is most of the students who are coming from metropolis or the big cities like Pune, Mumbai, Kolkata, their aspirations are clear, their career options are clear. That is, I'm going to finish up my graduation and then I'm going to apply for say higher studies abroad, and then I'll clear up the license or the permission to practice, and I'm going to stay on there. So let me conclude that I said that it's a professional kind of course, so it depends on your skill. So lot of things are there, that you can open up clinic also, you can have job also, otherwise you can work in academics also, otherwise you can go abroad also. So it all depends on what kind of future career you are planning. So I would say there are multiple options in this profession.
So there is worldwide scope in physiotherapy. So you can do it skillful way as you can. So, sir, after BPT, we can pursue PG. So how do we choose the branch of PG according to our interests or according to the scope of how branches?
Well, that's an interesting question. Most of the people have this question, and I have always a different kind of answer. I always say that first one is choose what you like, because it's like getting married to a person whom you don't like. So if you choose a specialty, if you don't like, then remember throughout your life you have to practice that specialty.
Okay.
Second answer I always give is like just look at the profession like eagle's eye and find out where there is more demand and try to pick up. Like say a few years back I used to tell the students that okay, there are a lot of people who are jumping into orthopedics, orthopedics, cardio and so on and so forth. You take up community. And today you won't believe that there's a highest demand for CBR or community. So this is second approach, that you got to look at that point of time where there's a shortage of say skilled human resources, and accordingly you can choose your specialization. And the first one is like as per your interest. If you ask me personally, my opinion, I would always say that pick up the specialization that you like, because you have to practice throughout your life.
Yes. Sir, what is your experience as a physiotherapist, and you have done the PhD in sports medicine and physiotherapy, so can you please tell us your experience?
Well, my experience is quite vast, and it's always like I started my entire career. I just started from GMC Nagpur, and after finishing my graduation, I was in Mumbai. I work in clinical side. I work in Children's Orthopedic Hospital. I work at All India Institute of Physical Medicine and Rehabilitation. Then from Mumbai, I shifted all of a sudden to South. I got into academics. I started as a lecturer during those days. Even with the graduation, you could get a job of lecturer because there were hardly private colleges. And then after working for 2 years, I realized that masters is important. During those days, there were hardly seats for masters, and it was just going on in Mumbai University. Somehow I couldn't make it because there was hardly one seat for the students who are passing out from GMC Nagpur or there is Nagpur University. So I went all the way to Kerala, probably I'm the first person from my family who has gone all the way to South to Kerala to do the post-graduation. So I did my Master of Physiotherapy from School of Medical Education, Mahatma Gandhi University, Kottayam, that's in Kerala. After finishing, I work in Jawaharlal Nehru Medical College, Belgaum. At that time, it was just a physiotherapy department, and I started my career as an assistant professor. Slowly, I developed the department, and then we got it as a transformed version of this department into institute. And then I was the first principal there. I worked almost for 10 years. Then I thought I should shift back to Maharashtra. Then I was in Aurangabad, Mahatma Gandhi Institute of MGM, we call it, the Mahatma Gandhi Memorial Institute of Physiotherapy. Then from there I shifted to Brother Institute of Medical Sciences. There also I got the college name changed to our former president, Dr. APJ Abdul Kalam College of Physiotherapy. Then I could get their Swedish collaboration, we call it the Linnaeus Palme, for almost 10 years. So I could send every year 2 students and 2 faculties to Sweden. Then I had nice experience with working with researchers from this Karolinska University in Stockholm. I had nice publications into the area of osteoarthritis also. Then, to attend varieties of the professional conferences and conduct workshops or plenary sessions, I had been to countries like Singapore, Malaysia, Bangladesh, then as I already told you, Dubai also. So almost like, Sweden. I had been to different countries also, but then I realized that our country is the best when it comes to environment,
Yes.
especially the cold environment, and the Indian food used to be always a troublesome thing. And then over the period of time when I was doing my PhD, I had deputation at Guru Nanak Dev University, Amritsar. So my supervisor was Dr. Jaspal Singh Sandhu, who was then secretary of UGC New Delhi. And he was the president of ISM, that is Indian Association of Sports Medicine. So I had a lot of things to learn about it, and I work into so-called tibial stress fracture and how to identify it. And way back in 2008, I completed PhD. So probably I was the first person from Maharashtra to get PhD into sports medicine and physiotherapy. I had a lot of achievements, like I got a fellowship award by Indian Association of Physiotherapists. Till that time, that award used to be given to the people who were quite old enough, like whose one leg is in the house and one leg is in the graveyard, that kind of the things. And I was the youngest person getting this fellowship in Indian Association of Physiotherapists award. And it just happened that people recognized my contribution in terms of authorship. I had written books like Basics of Electrotherapy, published by Jaipur Brothers, and Basics of Orthopedic Physiotherapy, once again published by Jaipur Brothers. I had written these books with simple mnemonics and things like MAMA, we call modality, appliance, movements, advice. Likewise, because I write in a simple language, this has been appreciated. So as of today, I got almost 7 books that are published. I'm happy to tell you that one of my book is translated in Indonesian language, and it's available even in Indonesia also, and people studies about electrotherapy. Of course, I get royalty for all these books, but I have almost more than 97 publications. I have 2 copyrights there. I have put up one for IPR also, and I was shortlisted for varieties of the posts like Vice Chancellor and things like that. Somehow with the luck, I couldn't make it. But I'm happy with my career and I enjoy teaching. So if you ask me honestly, almost every day I start with teaching. Because I always believe that whatever I started as a teacher. So I shouldn't forget. And that gives me some happiness. So that's in short about my profession. And I should say that I'm probably fully satisfied as a physiotherapist, as a teacher, as a professor, as a principal. And I'm happy to continue the same job to teach the students today also, because it's always interesting to interact with the young budding physiotherapists.
So obviously I have read your books. It isn't simple language, but which can be understood by every student, each and every student. So there is much more things to learn from you, and you can teach us. So sir, without taking your much time, the last question: what would you like to advise us, like as we are a physiotherapy student?
Okay, nice question. Before that, I'll just answer like what is my philosophy. My philosophy is very simple. That comes from Chinese proverb. I say, if you feed a person with a fish, you just fed him once. But if you teach him how to fish, you fed him throughout the life. Now let's come to the advice to the young professionals. I always say that it's a simple analogy. Imagine you go to South African jungle, you see the lion there, or you see another animal there, like say stag, or as you can say deer, or as you can say eagle. Every day morning in that jungle, when the lion gets up, lion knows that I got to run faster, faster, and faster than that jiggle or the stag. Otherwise, I'll be starving to death. Every day in the same jungle, when that jiggle or the stag or deer gets up, knows once again the same rule. That is, I have to run faster, faster, and faster than the lion. Otherwise, I'll become prey to the lion. Mind well, as a young budding physiotherapist, otherwise as a qualified, otherwise as a senior physiotherapist, whatever you are, whether you are lion, otherwise you are jiggle, the rule is same. That is, you got to run faster and faster, faster than others. Now let's understand what is the meaning of it. That means you got to keep updating your knowledge, skill, and attitude. The day you feel that you had enough and you are not going to update your knowledge or skill, that will be the end of your professional career. So to conclude, the message is very simple. Keep updating yourself. Thank you.
So thank you so much for your time and your valuable lessons from which everybody has learned very much from this podcast. Thank you, sir, very much for
Thank
your
you
valuable
all.
time.
Thank you so much. Okay, you can wind up. Thank you. God
Yes,
bless you.
sir.
Take care.